Alyssa.
And I'm Jocelyn.
And we're your Remember the Ribbon co-chairs here at Mercer University's SNPhA chapter.
Today we will be interviewing Dr. Moye-Dickerson, a faculty here at Mercer University, who's also an HIV pharmacist here in Atlanta.
So what made you get involved with working in the HIV community here in Atlanta?
I started here at Mercer. We didn't have anyone who was comfortable enough or wanted to teach HIV. And I had experience previously as a resident. I worked in an HIV clinic, and so I was probably the most comfortable, and so I started teaching. From that and moving to Atlanta and trying to stay up on the latest management of patients, and with HIV, it's not just the medications, it's lifestyle, it's cost, it's stigma, all of that. If I'm going to teach this to my students, I need to be involved in it, and I need to become certified. In order to get certified, you have to show that you help manage the care of HIV patients. For pharmacists, it's over the previous 2 years. I think we need to have been in contact with at least 20 or more patients that have HIV or AIDS. When I first became certified, there wasn't a difference between a pharmacist and a specialist, but now there is a credentialing differences because they recognize that the care that pharmacists take with patients may be a little bit different than a prescriber. My practice site is Wellstar Atlanta Medical Center, which is off Boulevard in downtown. So I actually see quite a bit of HIV patients, and on my service I kind of target those specifically too. So I'm internal medicine, but then I have a separate little service that I run for HIV patients, just managing them in the hospital, just looking, right? It's not a true management service because we don't really have that identified in the hospital, but it's something, a service that I kind of provide extra. And then I had to volunteer. My first organization I heard about was A Gwinnett, and so I started volunteering at A Gwinnett. Now I'm on the Atlanta Metro Area Planning Council for HIV/AIDS, and it's made up of everybody in the community: lay people, public health, pharmacists, physicians, even people who don't necessarily have AIDS but it impacts their lives. Right. Then they're on the council too. A Gwinnett has a huge volunteer cohort or whatever. Another good way to get involved is, of course, with SNPhA and Remember the Ribbon. I think this is an excellent way to get involved. The biggest thing that I see with a lot of my patients is still access. And true too, quite honestly, because I'm acute care, so I'm inpatient, quite a few of my patients, when we tell them that they're HIV positive, it's the first time they've heard it. The few days they're in the hospital, we may not have set everything up. So then we have to make sure we follow up with them. So the continuity of care thing. But if they get plugged in, for most patients, it's manageable because there are a lot of zero copay. But so that, and the other thing is still in the African American community, the stigma behind it. From what I've seen, the ones who have the biggest shock are the heterosexual African American female. And I think we've done a good job of overall getting out the message, but I do believe, Atlanta is still high as the number, I think we're fourth for new HIV infections in the country, but I think another small cohort of that are African American women. We're not in a whole lot of the studies, even with PrEP therapy, we're not aware of it. We may not think we need it. I just feel like more education is needed and targeted towards them.
Absolutely.
Very good question. I always ask, how many times have you stopped to your local pharmacy? Even if it's not for medications, but other stuff, you may go because you need some lotion, whatever. I feel like pharmacies can do more targeted, direct education about HIV. Also, I did a training with the CDC regarding pharmacists actually providing HIV screening for patients and potentially prescribing PrEP.
Well, thank you so much for your time. We appreciate you taking time out of your busy schedule to talk to us. Hopefully everyone who's viewing has learned something today. Thanks for tuning in with us today.
And hopefully you learned what it's like to be an HIV pharmacist in our community.